From the production studios of Montclair State University, this is NJTV News with Mike Schneider.
Nearly half of all babies born with the help of advanced fertility treatments are multiple births. While this may sound like twice the fun, there are risks. That's why many fertility experts are choosing to follow new guidelines to reduce the number of multiple births. Joining me now is Dr. Eric Forman from Reproductive Medicine Associates of New Jersey. Doctor, thanks for joining us.
Yeah, thanks for having me.
Okay, now in the past, typically patients want to maximize their chances of getting pregnant, so they want multiple embryos transferred, yes? Now there's a change for this. Why?
That's true. In the past, and for a long time, we really had the goal of one single embryo and a single healthy pregnancy. But success rates were compromised if you transferred one embryo. So patients did want to maximize their chances and transfer multiple embryos. But with improvements in technology and in vitro fertilization, we've actually improved our ability to select embryos and improve the safety and the success of IVF.
Now tell me about this. You can actually select which embryos could be the most successful.
Yeah, we've actually developed a technology called comprehensive chromosome screening, where we get really good insight into which embryo has the best chance of implanting. So it's not really just a beauty contest anymore like it used to be, where you would look under a microscope and try to pick the prettiest embryos, but those weren't necessarily the ones that had the best chance of making a healthy baby.
Now, there are also some financial costs associated with this, right? Say, for example, if you are doing IVF, it's an expensive process, right? So is it the same if you're using one embryo or more?
It can be an expensive process and an emotionally trying process for patients, but by using this technology of comprehensive chromosome screening and really getting a better idea of the potential of those embryos, it's actually a really great insurance policy to have a better pathway to success. It avoids transferring embryos that have the wrong number of chromosomes and don't really have a chance of making a normal baby, so avoids miscarriages, negative pregnancy tests, which are really disappointing for patients.
What is the feedback you're getting from patients?
Our patients are really excited about this technology, and they really have embraced the ability to combine it with single embryo transfer.
Now, there are also, along with the risk to the baby and the mother with multiple births, there are also financial costs associated with that as well, right? If the baby is born prematurely and they have to spend some time in the NICU. Tell me about this side of it.
That's true, and a lot of patients are very focused on the pregnancy. They've been trying for a long time, and understandably they want to get pregnant as quickly as possible. But they really want a healthy pregnancy and a healthy baby. And when we tell them about the risks of twins, the higher risk, about 5 times the risk of preterm delivery, much higher risk of having babies spend time in the NICU, they become less excited about that prospect. And it does increase the cost for the healthcare system. And it's, now we have really a better, safer way of doing it. We don't have to necessarily subject our patients to this side effect of infertility treatment.
I imagine, though, even with this research, there are still going to be moms who want possibly twins or more?
There are, and it's really about education and really convincing them that what they want is really 2 healthy babies eventually, and having them one baby at a time is just a safer way to do it. And we have the technology to be able to do that, to screen embryos, transfer one embryo. We can actually now very effectively freeze the other normal embryos, and she can come back and have another safe singleton pregnancy. So that's really the paradigm that we're promoting. In our practice, more than half of the transfers this year have been single embryo transfers, whereas nationwide it's still less than 10% of cases.
Fascinating research. Doctor, thank you for your time.
Thank you for having me.